Hi, I'm going to be showing you how to do a glute treatment today. We're going to be working over clothing and over towels. So I've got the bolster under the ankles to relax the legs, and my client's nice and warm. So I'm going to start on this side, and because we've got the towel on, we can't really do proper effleurage techniques because we're not using any lotion or medium. So I start with a form of palmar kneading, just working around the glute max. It is a large muscle, so it goes right around this iliac crest to the sacrum and over this bit here, the greater trochanter. So I want to try and cover all of that. So palm kneading is a form of petrissage. You can do this technique for a couple of minutes, and also with the rocking technique it's quite relaxing. If you want to start going a little bit deeper, there's a few techniques we can use. So we can use reinforced fingers, where I do this technique here and I'm working around that top of the hip or the iliac crest. So you'll feel some deeper circles. You can also work around that knobbly bit in the hip, which is the greater trochanter, it's the top of the femur. There's quite a few muscle attachments around here. We've got gluteus medius from the side, which I'm on at the moment, and a little bit further around the corner we've got the tensor fascia latae, TFL, and also one of the quads, the vastus lateralis, connects onto this bony landmark as well. So once we've gone all around the whole area, we can get knuckles in, again, which is a little bit deeper. Or we can lean over and get a little bit more with our elbow. So we can do elbow circles. Always make sure I've got two hands on the client rather than leaning all your body weight or leaning on the couch itself. And one hand on the client's back feels really good. So spend quite a lot of time working on that one side. We are going to do both. Okay, if they've got particular tension, you might see them tense up a little bit throughout this. You might hear a little moan or a groan, but let's just go with that. Once this is all warmed up, I'm going to keep contact, put my hand on the client, walk around, and I'm going to be working now on the same side, but just using slightly different techniques. So I'm going to be going with thumb compressions just around the edge of the sacrum and the top of the iliac crest here. So you can press your thumb in, you can push down and hold. So there's some good trigger points around this area. Press and hold. Or you can do the same technique with your elbow. So it gives your thumbs a little break. Just got to watch the amount of pressure. So constant feedback is also good. If I just show you with an elbow, we can do the same thing here. Press in, lean your body weight. We just go around the edge of that gluteus maximus. That's a bit of a tense there. So if you ask about pressure with your client, I use a pain scale or a pressure scale of 1 to 10. 10 is unbearable and 8 is quite uncomfortable, but the client can still cope with that pressure. So for problem areas, we do tend to go up to about an 8, but general massage is maybe 6, 7. Now we're going to locate the piriformis. The piriformis goes from this lower edge of the sacrum right through to the greater trochanter. So we can go right into the middle, or we can do that halfway, or imagine the glute max has been a big circle here and then we're going to go right into the center. So I'm going to go straight away this time with my elbow and just lean in just to increase that pressure. Okay, good. And we can change that compression technique into some friction. So you can use circular frictions, or we can go back and forward, put the other hand on the client there as well. So if you've done any range of movement tests and you've realized that muscle is particularly tight or short or contracted, a nice technique we can add into this is a term I call pull the pint. So what we're going to do this time is to bend the knee. We're going to then push the leg this way. The greater trochanter moves up and the muscle shortens. And then we're going to go with our elbow right into the center of the piriformis. Apply your pressure, fix that point, and then slowly bring the foot towards you. So we're creating a lateral rotation of the femur. And release the pressure, push it back in. Okay, but let's try and make it a little bit more flowing. So if we get a little bit of movement in there at the same time, the client will start to relax a bit more. Take the pressure off as you pull towards, apply the pressure. Okay, you can do that numerous times. You can do it with your elbow. We can even go with a fist, and it's just encouraging the mobility there in the hip joint. So after those fairly deep techniques, I'm going to place the foot back down, cover them up. Warmth is really important. And let's just go over that technique here. We're going to use a fist here. We can go back to a kneading technique. You can use your fingers. Working all around that area. So that's one side done. Now we're still on this side of the couch. It's good that we can work on the opposite side. So I'm going to repeat all those techniques on the right side of the client. So hand on the base of the back. I'm going to use my hand. I'm going to do palmar kneading on the glute max. So whole glute massage could take maybe 10 minutes. It's really good combined with lower back as well for any lower back issues, and also because of where the attachments are with the hamstrings. For tight hamstrings, it's also good to release this area. Might not be a massage that people book in for having their glutes worked on because they've never had it done before, but it's always something I'd probably recommend, and once they've had it done, they normally book in again for it. So we're using palmar kneading. Work all around that area. So as you're working, if you're practicing or doing this on the client, try and think of the anatomy underneath in your head. Just practice the muscle names and also the bony landmarks. So we're working around this bit here, which is the greater trochanter. It's the top of the femur. Working with our fingers. Work all around that. So I mentioned muscles that attach off the greater trochanter last time. If we can try and remember what they are, we've got the gluteus medius, got the gluteus maximus going over the top, the tensor fascia latae from the front, and we've got the vastus lateralis, the quad attaches to this area as well. So we've used reinforced fingers. We can go now to an elbow, just a little bit deeper pressure, using elbow circles. Go back and forward. So just covering that whole muscle. Okay, I'm going to keep contact now and walk around the couch. Place one hand on, go around the shortest way. You don't need to walk around the legs. And I'm there already, hand on the base of the back. And I'm going to do thumb or elbow compressions all around the iliac crest. I'm going to go with an elbow this time. So just lean and press into that. It's the origin of the glute max. Press and hold. Okay, you really need to be ambidextrous doing massage, so you can chop and change, use different sides. By the end of the day, after you've done 5, 6, 7, 8 clients, if you're just using one arm, you're going to need massage yourself. So try and work with both arms equally if you can. So I've worked all around those areas here. I'm going to locate the piriformis, so we can do it 2 ways. We can go halfway between the sacrum and the greater trochanter, or imagine it as a circle and go right into the middle with our elbow there. Okay, so apply your body weight, just lean into the technique. Okay, and then to help with mobility and general range of movement there for rotation, we're going to do the technique I called pull the pint. Expose the leg. And just have a little feel of the range of movement first. It's quite stiff that way. That's good. A little bit tight there. So once we're in a shortened position, put the elbow in, pull towards. It will feel tighter on the end here. Okay, and then I'll release the pressure, circle round. Can feel quite deep this. Just get the movement going. That's it. Okay, you can go with a fist. You can see the movement in the hip joint. That's good. And hopefully you start to feel it release. So you can go with knuckles. Go with thumb if you want as well. Just encouraging that movement. Okay, place the foot back down, cover up. And we're just going to work around there just to finish off. Never want to finish with a deep elbow technique. So just soothe off that area. We've got knuckles, or you've got leading here with the palm. And it's always nice to have a technique to finish off so the client knows when the body part is finished really. So a nice one here could just be hands on the glutes or hand on the sacrum here with a little bit of compression just to show you finished.